Lou, Jackie, and Mark Furry in for Jason Parkin.
Right.
And that smiling face you see sitting right next to yours truly happens to be the one and only Dr. Eugene Czerny. Good to see you.
Morning, guys. Great to see you again. It's been a little while.
I has.
You're coming out of hibernation.
Yes, I am.
Good for you.
Admit it. You guys missed me, right?
We did.
Of course we did.
Did you see your shadow when you came out of your hiding place? Or
A little bit.
a little bit, okay. Just double checking. But we're going to be talking about something that very popular, obviously.
Yes.
That is a big part of your business as well. But before we talk about that, we were just talking about whether or not Dr. Czerny, being the professional that he is, can you recognize from afar when people have had some work done, be it facelift or augmentation of some sort? And you said you have a pretty good track record.
I think I have about a 90% rate of being able to tell if somebody's had something. It depends on what kind of clothes they're wearing. Although on a face, I can usually tell if they've had their, eyes, nose, or a facelift done. Usually.
What's the first thing you look for something like that?
The noses tend to turn out a certain way, and in fact, my little kid that's out in LA right now, he said that it was really odd that all the noses kind of look the same in Los Angeles. And, I mean, that's like one of the giveaways there, the Los Angeles nose. But sometimes it looks too good. And sometimes it looks done, like some people have surgery and it's overdone, and you can see that it's
right.
fake.
Yeah. Okay, but what are we talking about here today?
But we're talking about, this is the thing that has made millions, that's right, literally millions of women very happy, probably in the tens of millions the world over. We're talking about breast implants, one of the most popular operations this time of year. This is high season for the placement of breast implants today.
Why is it this season? Why is this the season for implants?
High season, yeah.
Well, in Iowa it is, and where it's warm, you're doing it year round. But over here in Iowa, people like to do this stuff in the spring, so they start looking great for weddings coming up, cruises coming up on spring break, and that summer that they want to look good. On the boat, on the beach, stuff
So
like
they want to
that.
have time to recover and things like that so that they can enjoy it when vacations
absolutely.
come around.
That's right. That's right. Patients need a little bit of time just to have them heal and to feel good and to have the implants settle into place and look good.
Is it breast augmentations that kind of made plastic surgery just like explode on the scene, kind of?
In its time, they came out in the 60s, and then they've gone through, phases of development and improvement. It remains one of the most important things we do. And it's a paradox. It's not what people think it is. People don't actually. You don't have the guys trying to talk their wives into do it. The guys are always, they just like shut their mouth and say, "I'm just supporting my wife." It's like they all have a chip implanted in their brain, and they all say the same thing.
Really?
It's always the woman that's arguing that she wants, to have this for herself. And it's usually, and in my practice, it's almost always women who've had children that want to get back what they lost from having kids, and they want to look better in clothes. That's really all it boils down to.
Well, you talked about there's various phases that breast augmentation has gone through since it's been out since
Yes.
the 60s. So where are we at right now with the phase that people are in? Is there new kinds or what materials made of? What's going on these days?
They are. We still have not been able to get past silicone because it is the thing that feels most like a breast. It feels so much like a breast, so it tends to be invisible to the eye and invisible to the touch. And
Now, in
that's
the
what
late
people
90s,
like.
there was a lot of headlines that said that's
Yep.
not what you want to be using. Has that changed?
A lot. The earlier generation of silicone implants, they created some inflammation. The implants would tend to get hard, and so patients needed a lot of revision, which...
Would that be the
Plastic-
material that's inside the bladder here?
Yep, it's inside there, but it's more protected. It's in a thicker shell, and it's actually a solid jello. It's not a liquid silicone.
Really?
You can feel this. So you can feel that a little more. It's a little firmer than a natural breast, but at the same time, it's it's one that's not going to leak or cause any harm. It's been
So this is
extensively
obviously very
studied.
durable.
So it used to be
Yes.
liquid then, when they first came out?
Yes,
It
and-
wasn't a gel, it was a liquid.
It was liquid, and they felt so good. They were really great, but they had this problem
with
that they
leakage.
could leak.
Now, if this did get a puncture in the outer skin here, what would it ooze out, or would it just
No.
would it pretty much stay where it is?
Stays where it is because it's solid inside.
Okay, so that's a lot obviously a
nowhere
lot
to go.
safer.
So how would you know if you had an issue? Like,
That becomes an issue. Myself, I'm not. Sometimes we see. This becomes a controversial area because sometimes we see implants that appear to be ruptured, like on a mammogram or something like that,
Okay.
but they don't look like anything's wrong with them.
right.
And then, the patient wonders, well, should we go in and change it? And we've gone in on some of those and tried to fix it, and it turns out that they weren't injured at all, and that the mammogram was wrong. This has been my experience on a couple of cases last year. So I'm looking for a new approach, actually, on that.
So the new ones are much more reliable than you can pretty much count on them.
Indeed, yes, they are.
Wonderful. Now, what's the turnaround if somebody wants to have this done and want to have the implants put in? How long of a period of time is recovery?
Surprisingly low. We've had great advances in pain control, so a lot of people go back to work in like a few days.
That's really great.
Whoa!
Yeah, I know.
amazing.
I can't go back to a heavy labor job, of course, but you can go back to administrative work and supervisory work like that. Yeah, in about 3-5 days.
So you can't be breaking out the concrete slab at the gas station with a sledgehammer, right?
Yeah, that's right.
Yeah, okay.
No post hole digging.
Okay, yeah, okay. No post-hole digging for a little while after that.
breast
All right, so people want to get some more information on getting any type of plastic surgery done
Yes.
or maybe augmentation done. They can come visit you anytime, can't they?
Well, sure. Yeah, we have our monthly seminars, but we're right on Hickman Road by the Girl Scouts, and we're seeing consultations today.
And the monthly seminars, you can find out more information at your website.
Absolutely.
Yeah, heartlandps.com. Wonderful. Good to see you again, buddy.
Mighty fine to see you.
When you coming back?
Sooner than later.
Yeah, okay, sooner than later. Okay. All right, stay right there. We're not done yet.
Yeah, he always does.
Look at the camera right there. Tell them we'll be right back.
We will be right back.